The number of new infections stands at 127. That brings the number of total infections to 1,745. Those who've recovered today stand at 17. That brings the number of total recoveries to 438. New deaths stand at 4, all from Mombasa, bringing the total deaths since the COVID-19 virus entered Kenya's borders to 62. In terms of counties, the new number of cases in Nairobi County stand at 76. The new number of cases in Mombasa, or rather persons infected, stands at 19. The number of those infected newly in Busia stands at 16. Uasin Gishu 8, Kajiado 5, Isiolo 1. As for the new patients in Nairobi, this is how they're distributed. We have 49 cases in Kibra, 13 cases in Ruaraka, 4 in Makadara, 4 in Westlands, 2 in Langata, and 1 in Embakasi West, Kasarani, Dagoretti North, and Starehe each. In as far as Mombasa is concerned, the new cases, 7 of them are in Kisauni, 6 of them in Mvita, 3 in Nyali, 2 in Likoni, and 1 in Jomvu. And as far as Kenya's borders are concerned, we have 2 new cases at the Malaba border and 3 new cases at the Namanga border point. Burundi's government has been on the receiving end of criticism over its handling of the COVID-19 pandemic, as it has downplayed the disease and the risks involved. Now, the reality has hit home literally for the outgoing president, Pierre Nkurunzinza. His wife, Denise, has been confirmed to be COVID-19 positive. She was flown into Kenya and is currently admitted at a hospital in Nairobi. How did she get into a country with closed borders? Helen Ower reports that while the government appears to have reverted to some sort of normalcy, it is calling on Kenyans not to live life as usual.
The air is filled with energy of political charge. The just concluded elections in Burundi have been grounds for the government to show its stand on the pandemic, as well as rally its citizens towards its belief. Burundi is one of the African states that has been reported as having not taken effective measures to combat the spread of the coronavirus. But it seems the pandemic has shown its unbiased face as it has made its way into Burundi's State House. Outgoing First Lady Pierre Nkurunzinza and 3 of her bodyguards tested positive for COVID-19. Ms. Nkurunzinza was airlifted into Kenya for treatment under the cover of darkness Thursday night. This points to some questionable dealings in the government as Kenya closed its borders and airspace in seeking to curb the spread of the disease. And therefore, under what arrangement was the Burundian First Lady granted access into the country? Questions have been asked if such treatment would be accorded to non-dignitaries, even as some Kenyans are unable to come home. The Ministry of Health has, however, sought to distance itself from the matter.
And this issue is an issue that touches on foreign affairs, and a comprehensive statement will be issued in due course regarding whether we've been here right now and confirm for you yes or no, whether this is the situation. However, Foreign Affairs will be able to give you a statement on this.
The Ministry of Foreign Affairs has yet to pronounce itself on this matter. As these concerns remain at the top of many minds, the concerns about the local transmissions are still very alive, more so as Kenyans appear to be returning to normalcy.
I've also observed a worrisome trend. There are individuals who are using unofficial routes, these are panya routes, to get in and out of restricted areas. And we would like to remind such people that Nairobi and Mombasa are currently the counties that have the highest number of infections, and therefore sneaking out of these areas is equivalent to sneaking the virus into other counties.
The government has also put in place self-isolation measures as a means to help combat the spread of the disease.
Patients who are in isolation at home, either because of age or because they are breastfeeding mothers and small children, or they are pregnant women who may not be well managed in a health facility and are asymptomatic.
Helen Aura, NTV.